Okay. So you're probably very familiar with what's going on with your neck and stuff like that, and when they talk about degenerative disc disease or when they talk about surfaces coming closer together, a lot of people like to call that arthritis or degenerative disc disease. But what we know is that, like in many cases, that can happen. Sometimes it's completely normal with aging, but what it could do is limit our range of motion, create some stiffness, tension, tightness up into the neck and shoulder blades, because all of this kind of like protects itself, as we know. In your case, I was testing the nerves, which is great. I was testing to see if there was any neuropathy or anything like that that goes down into the arms and fingers, anything like that. All signs point no, so I'm not even going to mention any of that at this point in time, because there's nothing to point out at this point in time. So as we know, it can just cause a lot of stiffness and tension up into the neck. You've been to a chiropractor before, you know that we adjust the neck, and what we try to do is create mobility and movement through that area so that we can really decompress those areas and keep them free of injury, free of movement. And in your case, that seems like kind of what we would be doing. If you don't know much about me or my clinic, what we do here, in addition to adjustments, I do a lot of soft tissue work. So what we'll do is we'll kind of massage out some of the techniques, we'll kind of loosen up some of the tension before we do any of the adjustments, and that should make it kind of a lot more effective than just the adjustment alone. So far, any questions or anything like that? When I was testing your neck, again, I was testing to see how bad or how good things are. I know it feels really stiff for you and stuff like that, but really just like this movement and this movement was like the hardest thing for you, and that's usually when we're trying to really load and add a lot of pressure through these facet joints right through there. It's very common, especially when you're having arthritic changes or anything like that, to have these joints a little bit overloaded because they're really just aggravated. So good news is, it's something very simple. It's very easy to take care of and easy to manage, and as long as you just keep up with exercises and things like that, you're in pretty good shape. So this is a pretty straightforward case. I'd rather have more of these than but yeah. Any other questions? Cool.
No.
So while you're seated, I'll start working on your shoulders and stuff like that, and then we'll work our way to the neck. Okay?
My knees are like and stuff too.
You're getting that too?
Yeah,
Okay.
I know I do, because like